Hi all, my name is Stefan, and I'm the owner of My Surgery app. This training is a short and brief introduction for you on the app that your practice is now using. So your practice manager by now has probably told you that your practice will be using a patient-facing app. And this training video is aimed at receptionists or administrators in primary care to show you what the practice app can offer your patients and how it can benefit you in practice. Now, a little bit about me. I was a practice manager in a surgery in Swansea for 17 years and a cluster lead. And my office was actually in the back office with receptionists. I was answering phones every morning and then doing the management job in the afternoon. So I knew exactly what the demands are on receptionists and the call volumes coming through and how demanding patients can be and how difficult the job can be. So the app has been built to make access, give patients more choice of access, i.e. they can contact you or they can do things through the app. So we'll show you the brief app now. So this here is the app's homepage. When patients download the app, they will come to the app's homepage and it will have your search. So this is for St Mary's Medical Group, which is part of Cwm Tower Cluster, but these are fictional. It's a fictional practice. So when the patient registers for your app, it'll say your surgery name here and either your practice logo or a photo of your practice and whichever cluster then you are registered with. The patients can either contact you, and this home screen can be fully customizable from the management dashboard or portal, which your practice manager will have access to. So they can phone you. If your surgery is using online triage, such as eConsult or Ask My GP or Engage Health or Clinic or Accurix, one of the many suppliers out there, then instead of the patient now having to visit your practice website and then being redirected, they can now open the app's home screen and the first button here says, I need help with a medical issue. Send us an online query about a new or an ongoing symptom. So the patient can click here and then that will transport them then directly to your eConsult or Ask My GP or Engage Health platform, and they can then submit a query about a clinical query that they have. The next button here is then to order repeat medication. So a lot of patients are on repeat medication and they request meds in certain ways. They go to the pharmacy or they come to you, they phone if you do accept phone calls, or they very often will drop the prescription in your prescription box or fill out a form at reception. Some patients do order repeats online, and this button will link the patients directly with My Health Online, which is the All Wales health management repeat management system. Now, when they click the button, they come to a landing page with two options. They can either log in if they're already registered for My Health Online. They can log in straight away, or if they're not registered, they can click a registration button, and then that will take them through the registration process. So they no longer have to come in to practice anymore to fill out the form. Particularly with COVID, it's been very difficult for patients to come in. We've been promoting, haven't we, on patients using online services, but it's a bit of a catch-22. They can't use them if they can't come in to register. So now the app will allow them to register. So when they order repeats, they're given two options, log in or register. And we go through the same process. They can fill out the My Health Online application form. They can submit two forms of ID. Photo ID and then proof of address, and then you process that in the same way as you normally would if a patient's completed the application form in surgery. So we've got the next button here. It is now administration query. So we've done some audits or some research with practices in Wales, and just under 40% of telephone calls that come into a GP surgery are admin related. The rest are clinical. If you think about it, that's a lot of call volume for receptionists, a lot of work volume for receptionists to work through, just answering admin queries. So a lot of patients are unaware that they can make requests for admin queries through an app. They can do it digitally. And the kind of request that they can ask for is a fit note or a continuation paper. And if they ask for a continuation paper or a sick note, once they click on this button and they select the admin query they've got, if it is a fit note, if they've been sick for less than 7 days, then they can download the self-cert form directly from the app without having to come in to practice anymore to pick it up. They can submit a request for a self-cert form or request for discuss a recent test result or ask for a doctor's note or ask for anything really, whatever medical, whatever admin query they've got, they can now request that through the app, and they go through a drop down, and then they go through. It either links directly again to your eConsult or your Ask My GP platform, or it can be sent in via email. So when you are on the phone to patients, and you can recognise that our patients are making a request on the phone for these admin queries, you could say to the patient, "Oh yes, we'll do it this time, but next time you can do it through our app. Are you aware of it?" And then you can direct them to ways to download the app. Then, if I'm a patient, I don't want to phone the surgery and listen to a recording and then wait in a queue just to be able to say, "Can I have a continuation, please? A continuation note, please." So I would much rather do it digitally. It takes less than a minute to submit that, and then that's come into you. So imagine that your telephone calls or call volumes did decrease by 25%. How much more would that help you as receptionist? How much more could you better manage your day and your work volume if you had that reduction? So it is a good idea to sort of inform patients about these features in the app, and the more you understand what the app can do, the better equipped you are to inform your patients then. The next button is a symptom checker. So this symptom checker directs the patients to the NHS Wales 111 symptom checker tool. So if they do have any symptoms and they want to check what they are, instead of using Google from now on, or Dr. Google, they can use the symptom checker, and it's an NHS-based symptom checker, and it will actually tell patients, right, based on your symptoms, you should phone your GP, or you can go to your pharmacy and request over-the-counter medication, or go to MIU or go to A&E. It will advise patients and take them through a very brief, they answer a few questions. I think it's 4 questions in total, and then it kicks out the result for them, or they can self-manage. And if there are any self-help resources, it takes them to the next button here. So I want help for my condition. So if they click on here, they can search for any condition really. So it says find advice for conditions like back pain, coughs, headaches, and more. And again, this is all NHS based. We've imported this from NHS Digital in England. So it's all in English, but not yet in Welsh, but we are hoping to have it translated. But if they want any information for self-help, they can find that resource there. And there's a video library also with over 200 videos to tell patients. So if patients don't want to read a lot about a symptom, they can watch the video, and the video are all under 3 minutes and short and informative videos. Again, to self-educate patients, they don't need to phone the GP for everything. They can self-manage some things at home, or if it's appropriate, they can, and the videos will show them what's appropriate to go to pharmacy. So it's all about educating patients, because demand in primary care is going through the roof, and you guys as receptionists and administrators are faced with an uphill battle on a daily basis. Well, if we help patients to navigate the patients around the app's homepage, and maybe that can if that could reduce their attendance at surgeries a little bit more and self-manage a little bit more, then it makes your lives a little bit better. The last button here is community and voluntary services. So as you may or may not know, but your practice is now involved in a cluster. They work as cluster of practices in your area. And in those clusters, they may work with social prescribers, or care navigators, or link workers, or voluntary sector. A lot of multidisciplinary teams come together to work now and to give, not every patient needs a prescription. That we can prescribe different things like befriending groups, or walking groups, or bereavement counselling, or mental health support. So the patients can click here, and any resources in your area, i.e. in your surgery, but also in your geographical area where your cluster practice works, the patients can find services there, such as park runs, or befriending groups, or tea mornings, or whatever it may be that's available. The patients can find it there. So that's a very brief introduction about the home screen. There are other things, like you can see here, the health hub, and that's where patients can manage their own health. There's your surgery tab where they find opening times and addresses of your surgery, if you've got branch surgeries, and how to contact you. And then there's a what's on calendar, and that tells patients what time a diabetic clinic is on, or when you've got a flu clinic, or when you've got a coronavirus clinic, or if there are walking groups in the area, it'll tell them what time the walking group is on, where people meet, and there's instructions there. So the what's on calendar is really a listing of events of what's going on in your area. But this is what you need to concentrate most on as patient facing, because let's be honest, all requests that come through from a patient to a GP goes through the hands of a receptionist. You are the workhorse of the practice. There's nothing that doesn't come through you guys. So if you understand what the app can do and how it can help patients and how it can help to drastically, hopefully, reduce the call volumes into your practice, either by with the admin queries or repeat medication, then your practice manager will have a lot of resources of how to tell the patients about about the app you've got. You've got a pop-up banner that you can put in reception. There's a QR code you can put on your reception area. There's a poster with QR codes you can put in your consulting room, so GPs can refer patients to download the app. There's a QR code sticker that you can put on your prescription box. So when patients do put the prescription in, they can scan the QR code there to download the app that way. So there's lots of resources that we've given your surgery to help you, to help inform your patients about the app. But you guys can also play your part to help reduce your work volume as well. If you'd like more information, then please do ask your practice manager. They will have a more in-depth training video, or me, Stefan, I can give you a more in-depth training video as well. We're more than welcome to jump onto a Zoom meeting or a Teams meeting and do that. Okay, thank you very much for your time. Any questions, please do get in touch and we'll be more than happy to help.